If you or someone you love is living with ALS, I know that figuring out the financial side of things can feel like a massive weight, but it really doesn't have to be. So in this explainer, we're going to break down all the key disability benefits available, step by step, to help you get that peace of mind you absolutely deserve. And you know, it's totally normal to feel overwhelmed. The journey with ALS brings enough challenges on its own, you shouldn't have to add financial stress to the pile. The good news, there's a really solid network of support out there, designed to help, and you are definitely not alone in figuring this all out. So let's reframe this whole thing. This isn't about fighting through some complicated system, it's about claiming the support that you have already earned through years of your hard work. Just think of this as your personal roadmap to getting what's yours.
Okay, let's dive right in. We're going to start with the big picture, looking at your entire support network. And I don't want you to see these as separate, confusing programs, but as one interconnected system that's built to give you stability.
Now, the foundation of this whole network really rests on two main pillars: Social Security Disability Insurance, or SSDI, which is for your income, and Medicare for your healthcare. So let's tackle that first one, SSDI.
So what exactly is SSDI? Well, think of it like this. It's a monthly benefit that's paid to you based on the Social Security taxes you've been paying throughout your entire career. It's not a handout, not at all. It's an insurance program you've been paying into. And for people with ALS, there's a really crucial advantage.
And this right here is the game changer. It's the fast-track process. Because ALS is on what's called the Compassionate Allowances list, your application gets flagged and sent to the front of the line. This means you skip the long waits, and this is huge. That standard 5-month waiting period for benefits, it's completely waived for you. You get the support you need right when you need it.
So what does that support actually look like in dollars and cents? Well, the exact amount is going to depend on your past earnings. But for most people, it's a stable monthly income that helps cover the mortgage, the groceries, all the daily costs. It's really designed to bring a sense of predictability back into your life.
Okay, so income is one piece of the puzzle, but healthcare is the other massive one, right? Well, just like with SSDI, the system recognizes how urgent this is. So for people with ALS, the rules for Medicare are completely different.
And this is just an incredible difference. For most disabilities, there's a 24-month wait for Medicare to kick in after you start getting SSDI. But for ALS, that wait is completely gone, wiped out. Your Medicare coverage starts the very same month as your SSDI, which means you have immediate access to all the care you need.
And what does that Medicare coverage include? It's broken down into a few main parts. Part A helps with hospital stays. Part B is for your doctor visits and things like physical therapy, and Part D helps pay for your prescription drugs. It's really a comprehensive package designed to cover all the essentials right away.
All right, so now that we've got the core pillars down, let's look at some of the more specialized support. Because beyond SSDI and Medicare, there are other benefits that are tailored to your specific situation, like your financial need, or if you have a history of military service.
Okay, this is something that can be a little confusing, so let's clear it up. The difference between SSDI and SSI. The key thing to remember is this. SSDI is based on your work history. SSI, on the other hand, is based on your financial need. So, if you have low income and few assets, you might actually qualify for SSI in addition to your SSDI, which is a huge help.
Now, for our veterans, the support network is, frankly, incredible. If you served for at least 90 consecutive days, the VA automatically presumes your ALS is connected to your service. This unlocks a 100% disability rating and a powerful set of benefits, from really significant monthly compensation to specialized healthcare and even grants to help modify your home or vehicle. It's a system designed to support you and your family.
So what about those costs that Medicare might not fully cover, like long-term care at home? Well, that's where Medicaid comes in. It really acts as a vital safety net. It's there to fill in the gaps and help pay for those essential services, like in-home caregivers, which can make all the difference in maintaining your quality of life.
Now, federal programs are a huge part of the picture, but they're not the whole story. There are other layers of support you might be able to tap into through private insurance or maybe even your state. So you'll definitely want to check if you have any private disability policies, maybe through a current or former employer. A few states also have their own disability programs, so that's worth a look. And don't forget this, your SSDI benefit can actually extend to your family. Your spouse and children may be able to get a benefit too, which adds another layer of security.
Okay, I know we have covered a ton of ground, but all this knowledge is only powerful if you act on it, right? So let's take all of this information and turn it into a simple, clear action plan.
Applying for these benefits doesn't have to be some big, intimidating thing. It really just comes down to 3 basic steps. First, get your key documents together: medical records, work history, things like that. Second, you can apply right online. SSA.gov is for Social Security, and VA.gov is for Veterans Benefits. And third, just keep a record and track your progress.
And let me leave you with a few final tips for success. The single most important one is to apply as early as you possibly can. Be really thorough with all your information. And please, don't ever hesitate to ask for help. That's what the representatives at Social Security and the VA are there for. And just remember this: the approval rate for ALS cases is incredibly high. You've got this.
So, as we wrap up, I just want to leave you with this one question. Thinking about everything we've talked about, what is the one single step you can take today? Maybe it's just finding one document, or bookmarking a website, or maybe just deciding you're going to make that call tomorrow. Taking that one small first step is the most powerful move you can make toward that peace of mind.